Greetings everyone, I am Dr. Suchismitha Rajamanya, lead consultant in the Department of Internal Medicine, Aster Whitefield Hospital, Bangalore. If you are suffering from symptoms like generalized body pains, muscle aches, muscle cramps and twitching of the muscles along with fatigue, you might most likely be suffering from vitamin D deficiency. Vitamin D is a fat-soluble vitamin and it's very important in the normal development of bone and its maintenance, as well as calcium metabolism. The deficiency of vitamin D can lead to an array of clinical problems like rickets in children and osteomalacia in adults. In severe and chronic cases, it can lead to osteoporosis and fragile fractures. It is estimated that about 1 billion people worldwide suffer from vitamin D deficiency. We should know that about 50 to 90% of vitamin D is synthesized in our skin by the action of UV radiation on 7-dehydrocholesterol. This component is further metabolized in the liver and kidney to give rise to the most active form of vitamin D, which is called 1,25-dihydroxyvitamin D, and this increases the absorption of calcium from the intestine and reduces the excretion of calcium and phosphorus in the kidneys. Vitamin D deficiency can occur due to many reasons, especially decreased sunlight exposure. It could be because of inadequate dietary intake and malabsorption because of conditions like inflammatory bowel disease, celiac sprue, or gastric bypass surgeries. It could also be because of liver and kidney issues, and sometimes it could be hereditary. The people who are at increased risk of developing vitamin D deficiency are the elderly, the obese, hospitalized patients, and people who cover their skin extensively. The diagnosis of vitamin D deficiency can be made by a lab test which detects a form of vitamin D called the 25-hydroxyvitamin D. A value less than 30 nanograms per ml is considered as deficiency. The management of vitamin D deficiency is by supplementing with cholecalciferol. We usually give a dose of 60,000 international units weekly once for either 8 to 12 weeks, or we can also give 6,000 international units per day. And once the value crosses 30 nanograms per ml, we can switch over to a maintenance dose of 1,000 to 2,000 international units per day. We recommend sunlight exposure for at least about 20 to 30 minutes per day with 40% of the skin exposed so that we get the daily required amount of vitamin D. Apart from vitamin D being important for the normal development of bone and muscles, there are various studies which indicate that vitamin D is very important in preventing cancer, in managing the health of the heart, in preventing diabetes mellitus. So if at all you develop any symptoms suggestive of vitamin D deficiency, please do seek medical help to rectify this issue. In the scenario that you develop body pains, muscle aches, tiredness or muscle cramps, do come to the Internal Medicine Department at Aster Whitefield Hospital for further evaluation and management of the same.